Poor sperm quality is a major reason for infertility these days. As we mentioned, 1 in 6 couples find it difficult to get a pregnancy, and I would say 50% of such couples have a direct or an indirect reason that the sperm quality is not good. What do you mean by sperm quality? What is it? Now we have to understand that sperms are the germ cells that are produced by the man. These are produced in plenty of numbers by the testes. About 100 million sperms are produced every day, and they take around 2 months time to mature inside the testes. Then they come out through a pipe that comes out of the testes and travel through that pipe for another, let's say, a couple of weeks, and then they're stored, and then when there's ejaculation that happens, the semen containing the sperms come out. Now the sperms that come out in a single ejaculate, they could be anywhere between 30 million to 300 million. But we say a good sample is where at least 40 million or more sperms are present. WHO, that is the World Health Organization, has looked at the semen sample and has given us a classification, or let's say a standard semanalysis situation, where it's expected that the semen volume should at least be 1.5 ml. It should contain at least around 40 million sperms. Almost half of these sperms should be motile. By motile, they should be able to swim from point A to point B. And at least 4% of these sperms should look healthy in the microscope. So that is broadly the definition of a good semen sample. Now, unfortunately, almost 50% of couples who are not getting pregnant are not doing so because of the lack of good quality sperms. Now, that good quality could be of 3 kinds. You could have less sperms, meaning there are sperms less than 40 million per ejaculate. The sperms may be adequate in number, but they could be non-motile, that is, they're not swimming in adequate numbers, so they cannot swim all the way from the vagina to the tube, that is where the egg is settled. Or they could not be looking good, they're functionally not healthy. So accordingly, oligospermia is where you have less number of sperms, less than 40 million per ejaculate. Asthenospermia is when the sperms are non-motile, they cannot swim from point A to point B, or less number of motile sperms. And Teratozoospermia is where the sperms are defective looking. They don't look healthy and maybe functionally that they're not healthy. So you could have either an oligospermia or asthenospermia or a teratospermia or a combination of any of these. All of these constitute what we can say is poor sperm quality. Now the next question is how many people are affected and which age group is affected the most. So quite obviously, this is the age group that is trying for a child. This is the age group that is actually getting a semen analysis done. So the data that we have is only for that age group. Now 50% of men who are trying for a child and not getting pregnant have this problem. So if you were to put a figure to this would be anywhere between 7 to 10% men at any given time have poor quality sperms. And that is a major cause of infertility these days.